To create an effective public access defibrillation program, first identify members of your emergency response team. Team members should include athletic directors, nurses, coaches, maintenance staff, teachers, students, parents, administrators, and other interested individuals who will be fully trained and certified to perform CPR and to use the AED. It is important to include team members who are available to support after-hours and off-site events. Just as sports teams prepare for the big game, emergency response teams must practice to ensure an automatic and efficient response in an emergency. Cardiac emergency response should be a part of your school's comprehensive emergency response plan. Be sure that each team member is familiar with the location and content of this plan. Using a mannequin and a predetermined reality-based drill scenario allows the team to go through each step of the emergency response just as they would in a real emergency. Conducting cardiac emergency drills is similar to running fire drills. They should be conducted several times throughout the school year. They should be performed during the school day and during after-school events. They should be unexpected to test the response plan. School administration should be notified prior to planned drills to avoid unintentional calls to EMS. When conducting a drill, it is important to carefully rehearse each step of the response, just as if it were a real emergency. First, check for responsiveness by tapping on the victim's shoulder and asking, "Are you okay?"
"Are you okay, Miss Jones?"
If they don't respond, get help.
This is Harold Smith.
Activate your school's emergency response.
10-4.
Call 911. Start CPR, and get the AED immediately. You may see some involuntary muscle movement or gasping. Do not mistake this for a response. Consult your school's emergency response plan to confirm the proper procedure for connecting to your EMS. Your school emergency response plan should also include specific agreed-upon wording for public address announcements used in activating the response team.
This is a drill.
Storing an AED in a highly visible, easily accessible, and central location rather than behind a closed door can mean the difference between life and death. Never lock your AED. Easy access is key. Once the AED is retrieved, the pads should be placed on the victim's bare chest. Then follow the AED voice prompts.
No one should touch the patient.
Clear.
Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered.
Once help is on the way, it is important to continue CPR with the AED connected until paramedics arrive. Remember, minutes matter in responding to a cardiac arrest. Therefore, during drills, it is important to keep track of your response times and look for ways of minimizing them with each successive practice. Responding to an emergency, whether in practice or reality, can be both physically and emotionally exhausting. No matter the outcome, it is important that response teams take the time needed to debrief and to discuss what has occurred and seek any additional resources necessary for coping with the situation. With a well-trained team and regular drills, you will be ready for an emergency.